Okay, guys, Timmy coming at you here, and I'm putting together a little video on beta blockers. I put a video on YouTube. Want to take a look at it, but I just wanted to add a few more things. First of all, I added a list of the common beta blockers. So those are the generic names the government gives you, and most beta blockers end in LOL, and these are the brand names. So familiarize yourself with those. Those are the most common ones. Again, I placed a video in this little section here so you can look at the functions of beta blockers. What I want to do is I just wanted to go over some of the indications for beta blockers. So look, the most common reason beta blockers are prescribed are for high blood pressure, hypertension. The other indication is for post-MI. So I want to explain that a little bit. So when you stabilize a patient after they've had a heart attack, what you don't want is you don't want their heart working hard. So how do you know your heart's working hard? Well, your heart rate and blood pressure are up. So I'm not going to get too crazy on this, but what I am going to do is just show you a little bit about how beta blockers work, and I'm gonna cheat just a little bit, so I hope you don't mind. So you have a heart cell here. How do you know it's a heart cell? I'm writing heart cell on it. And you have, again, you have these little beta receptors. In your heart, you have beta 1. And you have the blood. And again, you always have a little bit of epinephrine and a little bit of norepinephrine, the neurotransmitter for the sympathetic nervous system, floating around in your blood. So having said that, let me explain how this works. When epinephrine from the blood binds to a beta 1 receptor, essentially what it does is it opens up more sodium and more calcium leak channels. So the most important element in muscular contraction is calcium. So if epinephrine allows more calcium to go from the blood into the heart cell, that's going to increase the force of contraction of the heart, and that is going to increase your systolic blood pressure. Sodium is involved in the depolarization of the heart, meaning sodium naturally leaks in to the conduction system of the heart. So when more sodium leaks in as a result of epinephrine, that increases your heart rate. So take a look here. You have coronary arteries that supply oxygenated blood to the heart muscle. So let's say, for example, that you have a blockage in your coronary artery. So we'll make it yellow, right? So you got cholesterol building up in that artery. That ain't yellow. It's terrible. There we go. So cholesterol is building up in that artery. So what that means is that this artery is blocked. So when the coronary artery is getting blood flow, that blockage is going to impair the amount of oxygenated blood that you can send this area of the heart. Well, when the heart is demanding more oxygen because it's working harder, and the coronary artery can't supply it because there's a blockage there of cholesterol, you will get ischemia. Ischemia is lack of blood flow. Hypoxia is lack of oxygen. So if you're ischemic, you're hypoxic, just the way it goes. And when that ischemia lasts a while, you get chest pain. You get chest pain because pain tells you there's something wrong. You should write that down. Meaning you're lacking blood flow. And know this, the pain receptors in your guts are different. They're more spread out than the pain receptors on your skin, let's say. So when people get chest pain due to ischemia, lack of blood flow through the coronary artery due to a blockage, a cholesterol building up inside that artery, then they will get pain that's described as crushing pain. Pain that tends to radiate up their cheek, up their neck, and down their left arm. That's because the nerve, the spinal nerve, T1, supplies nervous innervation to the inside of the left arm and the neck. That's why that chest pain tends to radiate there. They're going to get other symptoms too. They're going to be short of breath. They're going to be anxious because they're having chest pain. They're having pain. And they may get diminished blood flow to their brain, so they may develop dizziness, lightheadedness, right? But they'll also be anxious, and that's a bad thing. Because when you're anxious, that makes your heart rate and blood pressure go up, and that is not good if you are ischemic. So watch. If you lack blood flow through that artery to this part of the heart, and when your heart rate and blood pressure go up, that means the heart's working harder. And if the heart is working harder, that means it needs more oxygen. So you have to deliver more blood to that part of the heart, or the heart in general. But if you can't supply enough oxygenated blood to this area of the heart, you will get ischemia and you will get chest pain. So it's real simple. Do you want a person's heart rate and blood pressure to go up if they have blockages in their coronary arteries? Well, the answer is obvious, right? I'm going to write it down just a second. No. So what are they placed on? They're placed on beta blockers. Because what do beta blockers block? And if you say beta, I will mark your whole life wrong. Beta blockers block beta 1 receptors primarily in the heart. What will happen is there will be less sodium leaking into the heart, so your heart rate will drop, and there will be less calcium getting into the heart, so the force of contraction will drop, and therefore the systolic blood pressure drops. So if your heart rate and your systolic blood pressure drop, then the amount of oxygen the heart is requiring drops. And that's exactly what you want when you have a blockage in your coronary artery. So to manage that, for people who have blockages in their coronary arteries, to manage that, to prevent them from hitting a heart rate and a blood pressure that is going to cause chest pain, they are placed on beta blockers. And that's essentially how cardiac rehab works. Cardiac rehab doesn't make your heart any stronger. It doesn't increase the size of your coronary arteries. All cardiac rehab does is train your body so that when you're exercising, your heart rate and blood pressure are lower. So people who are in good shape, their heart rate and blood pressure are lower all the time. If you're exercising and you're out of shape and someone's doing the same exercise at the same intensity and they're in good shape, their heart rate and blood pressure are lower because exercise blunts epinephrine. So beta blockers take advantage of that for people who don't want to exercise. It's medicine's way of training your heart, essentially. So beta blockers are the first line drugs to be given in people with coronary artery disease and post MI. The last thing you want, if this artery is completely blocked and they have suffered a heart attack, so this part of the heart is dead, the last thing you want is for that heart to work hard. So they are placed on beta blockers to take the workload off the heart, and it does that by reducing the heart rate and by reducing the force of contraction of the heart. And when the force of contraction of the heart decreases, your systolic blood pressure decreases. Hope that helped. And I'll come at you with another video. Okay. See ya.